What is the Musculoskeletal Service, the MSK service?
It's the non-surgical arm of the hospital, really. I think historically the trust has been very heavily surgically led, which is great for those patients that need an operation, but there's a huge group of patients out there that who have problems that don't require surgery. So really it's our job to identify what non-surgical treatments they require and then provide the appropriate treatment.
And what services do you offer for patients?
What we've done is we've pulled together orthopaedic doctors, specialist physiotherapists and podiatrists within the same clinic, okay, so that we can bounce ideas off one another. And it really is, it gives the patient a much more rounded, robust opinion. And once that diagnosis has been made and appropriate investigations done, there are several different treatment services that we offer. The physiotherapy department, for example, offers a one-to-one outpatient treatment service. We have gym rehabilitation with a whole host of different classes, and we've got the hydrotherapy pool for those patients that need that more specialised treatment within the water. And as well as those services, we've got more specialist services, such as the functional restoration programme and the heel pain clinic.
What do you do for people who are at risk of long-term disability?
We use a tool called the Start Back tool, which has been developed by a local university, and it's a series of questionnaires that aims to categorise, or I suppose predict, whether that patient is at risk of developing long-term problems. And if we do identify that there are these risk factors, we've got a functional restoration programme, which is a 4-week, quite intensive programme led by an orthopaedic physician or a doctor, alongside a physiotherapist and a counsellor, to introduce physical rehabilitation. And I'm supposed to show people that exercise is okay and it's good to move, and increase their spinal fitness while addressing maybe some of these other issues that may be stopping them from getting better.
What services do you have for people with foot problems?
We have a dedicated podiatry department with extended scope podiatrists and also specialist podiatrists, I suppose, whereby they will assess patients and can provide orthotics, give joint injections and soft tissue injections. But we also have a specialist heel pain clinic. And the idea when we set up the heel pain clinic was to identify those heel pain patients that are often quite difficult to manage and historically don't respond well to surgical intervention, and to give them an evidence-based treatment pathway that includes provision of specialist footwear and orthotics, as well as physical type therapies and rehabilitation, but also shockwave therapy, which is quite a novel treatment that I believe isn't offered in many places. And the outcomes have been very positive so far.
What services are there for people who have sports injuries?
We've got a dedicated sports injury service that runs once a week, and the idea is that we provide the patient with a one-stop assessment and treatment on that day, and we've got ultrasound scanning, so they can have an ultrasound scan to look at the soft tissues in more detail, which helps diagnosis, and we've also got the shockwave treatment, which we use in the heel pain clinic, is also used within the sports injury service too.
How effective are these specialist clinics?
We feel that offering a specialist service more so than a generic service really offers the patient the best chance of receiving that specialist advice and diagnosis, and therefore a treatment that's more tailored to their individual needs. Patient satisfaction questionnaires have been very, very positive, which is great to hear. But also GP satisfaction questionnaires have shown that they seem to be happy with the service too, which again is great feedback. Some of the patient-reported outcome measures that we use in all clinics have shown that the levels of disability reduce, levels of pain medication use also reduces. So overall, it's very positive.